How vitamins A and D can help provide relief from allergies by Dr. Byram Bridle, Scientific Advisor for Immunoceutica. For many people, the spring and summer are accompanied by allergies. Others must deal with this issue year-round. Allergies are the manifestation of a dysregulated immune response that is technically known as a type 1 hypersensitivity. Upon first exposure to an innocuous molecule in the environment, the immune systems of most people will determine that it is not dangerous, and they will develop tolerance. However, some people will develop a specific type of antibody known as IgE. This is supported by types of white blood cells called T helper type 17 and Th9 cells. If re-exposed to the molecule, now known as an allergen, the IgE type antibodies can simultaneously bind to it and a specialized white blood cell known as a mast cell. When this happens, mast cells undergo a process called degranulation, which means they release molecules like histamines and others that are the underlying cause of allergic reactions. This is why antihistamines are often part of the repertoire of treatments for allergies. The array of molecules released by mast cells cause the signs and symptoms associated with allergies. White blood cells, known as eosinophils, often exacerbate allergic responses. So, at their core, allergies are caused by a lack of proper regulation of the immune response, somewhat akin to a major intersection where the traffic lights have malfunctioned. The immunoceuticals, known as vitamins A and D, can help prevent or dampen allergic reactions by promoting proper regulation of the immune system. Although each vitamin on its own promotes immunoregulation, they are both needed in sufficient quantities to achieve optimal regulation of the immune system and therefore to minimize allergic responses. Some of the ways these vitamins work together to accomplish this is by 1. Decreasing the number of Th17 and Th9 cells that can otherwise promote production of IgE. 2. Increasing the production of a cytokine called interleukin-10 that suppresses allergic responses. 3. Increasing the number of white blood cells known as regulatory T cells, which prevent unwanted immune responses. 4. Increasing the immunosuppressive potential of each regulatory T cell. 5. Causing effector T cells to express higher concentrations of molecules that can function as switches to turn them off. 6. Promoting the differentiation of a component of the innate immune system, known as natural killer cells, into a specialized regulatory subset that can prevent inappropriate T cell responses. 7. Decreasing the amount of the cytokine interleukin-15 in the lungs, which is responsible for recruiting eosinophils that contribute to allergies and asthma. Fewer eosinophils reduce the risk of an allergic reaction. 8. Reducing the quantity of molecules secreted by mast cells that promote inflammation and dilation of blood vessels. Clinical trials have shown that low circulating concentrations of vitamins A and D are associated with enhanced risk of developing allergies, whereas supplementation correlates with reduced severity and/or prevention of allergies. Vitamins A and D are used by many systems in the body, and if they are in limited quantities, the immune system gets only what is left over, which can be insufficient for functioning optimally. Within the immune system, the cells involved in immunoregulation have the highest metabolic requirements for these vitamins. So, if you want to minimize the risk of developing allergies or maximize your relief from existing allergies, research suggests you need to have enough vitamins A and D circulating in your body to achieve immunosufficiency, which is the amount required to ensure optimal functioning of the immune system. This amount is higher than what most other systems in the body require. Research suggests that immunosufficiency can be achieved if concentrations in the blood are at 0.52 to 2.09 micromoles per liter for vitamin A and 150 to 250 nanomoles per liter for vitamin D. Concentrations that are substantially higher can place a person at potential risk of toxicity since these fat-soluble vitamins can accumulate in the body, unlike water-soluble vitamins that get readily eliminated in urine if in excess. Since every person responds differently to supplementation, it is not possible to advise a single dose that will ensure everyone achieves immunosufficiency while remaining far from toxicity. Therefore, at Immunoceutica, we like to say, test, don't guess. Use laboratory testing to rationally inform your personalized dosage. If below the minimum cutoff for immunosufficiency, take a little more for 6 to 8 weeks and test again. If above the maximum ideal concentration, decrease the dosage to avoid wastage and potential risk of toxicity. Immunoceutica offers vitamin D supplements and a convenient mail-in test kit for assessing your vitamin D concentration. Soon, we will be launching a vitamin A supplement, and in the longer term, are working on designing a test to determine vitamin A concentrations in blood. The information provided here is for educational purposes. It is recommended that any changes in supplementation be guided by a healthcare professional.